testing. I'm your student nurse today. Could you verify your name and date of birth for me?
Abby Donovan, 08/17/2004.
Okay, I'm going to provide you with some privacy. So, Ms. Donovan, we are going to be doing a head-to-toe assessment today for you. I'm going to start by analyzing all of your body systems from your head to your toe. To begin, I'm going to start with your head. I'm just going to take a look. Upon inspection, your head is normocephalic and midline. You mind if I take a feel? Okay. Just going to palpate real quick. Is there any pain or tenderness?
No, ma'am.
Okay, no pain or tenderness noted. There were no lesions or abnormalities on the head. The next thing I'm going to do is get you to puff out your cheeks, scrunch your nose, raise your eyebrows, smile with teeth, smile without teeth. Can you clench your teeth? And wrinkle your forehead. Okay. Cranial nerves 5 and 6 are intact. Patient has symmetric facial movements at rest and with movement. The next thing I'm going to get you to do, if you could just close your eyes, I'm going to hand you something that you need to taste. If you could tell me if it is sour, sweet, or salty.
Sweet.
Okay, you can open your eyes. Patient accurately identifies a sweet taste. Cranial nerve 7 is intact. I'm going to palpate your sinuses. Could you let me know if there's any pain or tenderness? This is your frontal and your maxillary. Okay, no pain or tenderness noted upon palpation of frontal and maxillary sinuses. Next, I'm going to move down to your eyes. Upon inspection, there are no protrusions of your eyes or scleral icterus. I'm going to get you to perform a test for me. I need you to look right here. I'm going to move this, and I need you to follow with just your eyes, not your head. Okay, perfect. No nystagmus is noted. Cranial nerves 3, 4, and 6 are intact. Just looking at your eyes, your pupils are about 4 millimeters without light introduced. I'm going to get you to look over my shoulder for me, and then focus right here and follow this to your nose. Okay, eyes are reactive to accommodation. I'm going to introduce this light to your eyes. You could just look forward at me. Okay, pupils constrict to 2 millimeters when light is introduced. Pupils are equal, round, reactive to light, and accommodation. The last thing I'm going to do is just test your red light reflex. Just going to shine this light in your eye. Okay. Okay, red light reflex is present bilaterally. Now I'm going to move down to your ears. For your ears, I'm just going to take a look and inspect. There's no crusting, erythema, or edema of the external ears. I'm going to feel them. Any pain or tenderness? Okay, bilateral auricles are non-tender to palpation. The next thing I'm going to do is a whisper test. I'm going to get you to occlude this one ear. Just close it off. I'm going to whisper 3 words behind you, and I need you to repeat them. And I'll come back and do it on the side for you.
Red house dog.
Perfect.
Yellow car hat.
Okay, perfect. Patient accurately repeats back 6 whispered words for the whisper test. Cranial nerve 8 is intact. Next thing I'm going to do is just a Weber test. I'm going to strike this tuning fork and put it on the top of your head. Let me know if you feel it, if you can hear the vibrations equally, or if it's better in one ear than the other.
Equally.
Okay. Patient states vibrations are heard equally. No lateralization is present. Last thing I'm going to do is just check inside of your ears really quickly. Okay. Other side. External ear canals show no signs of erythema, edema, lesions, or any foreign bodies. Your tympanic membranes are patent and intact. Your tympanic membranes are also shiny, pearly gray, and translucent. The cone of light is visualized at the 5 o'clock position in your right ear and the 7 o'clock position in your left ear. From there, I'm going to move down to your nose. If you, let me just look. Your nose is midline and straight. If you could close your eyes for me, I'm going to get you to smell something. And if you could just identify the smell.
Alcohol.
Okay. Patient accurately identifies a familiar scent of alcohol. Cranial nerve 1 is intact. If you could occlude one nostril for me and inhale, and then do the same for the other. Okay. Bilateral nares are patent. Next, I'm going to move down to your mouth. You open wide for me. You stick out your tongue and stick your tongue up. Okay. Frenulum, tongue, buccal mucosa, soft palate, hard palate, posterior pharynx, and uvula are all pink and moist. Your uvula is midline. Your frenulum is intact. You have a 2+ grade of your tonsils. Your teeth are white and appear to be of good hygiene. There are no dental caries present. Then if you could just stick out your tongue one more time for me. Okay, patient is able to stick out tongue midline with no deviation. Cranial nerve 12 is intact. And then if you could just swallow for me. And open your mouth and say, okay, and then I'm gonna test your gag reflex. One more time. Perfect. Patient's gag reflex is intact. The uvula and soft palate both rise and fall when patient states ah, and she is able to swallow on command. Cranial nerves 9 and 10 are intact. From there, I'm going to move down to your neck. If you could just look up a little for me. Your trachea is midline. I'm going to feel it. Any pain or tenderness? Okay, trachea is non-tender to palpation. I'm going to feel your lymph nodes. If you could tell me if there's any pain or tenderness with that. I'm going to name them as I go. Pre-auricular, posterior auricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and supraclavicular. Any pain or tenderness? Okay, all lymph nodes are non-tender to palpation, and there are no swelling or enlargement of the lymph nodes. Now I'm going to feel your carotid pulses. Okay. Both of your carotid pulses are 2+ and regular. Now I'm going to take a listen. If you could look towards that for me. I'm going to get you to inhale, exhale, and hold when I say so, and I'm going to listen for any adventitious heart sounds. Okay, inhale, exhale, hold. Okay, next side. Inhale, exhale, hold. Okay, perfect. No bruits are auscultated in your carotid arteries. Next thing I'm going to do is just check your skin. Your skin is even and consistent with your race and ethnicity. I'm just going to feel. Okay, your skin is warm and dry to the touch. I'm also just going to check your skin turgor real quick. Okay, you have good skin turgor evident by no tinting of the skin. Next, I'm going to move to your respiratory and your cardiovascular. Upon inspection, you seem to have even, unlabored, and regular breaths. If you could just move to this side for me real quick. Your AP ratio is 1 to 2, and I'm going to check your chest wall expansion. If you could breathe in and out. Okay, chest wall expansion is symmetric. Now, while I'm back here, I'm just going to go ahead and auscultate for your lung fields. When I touch this to your back, I need you to take a deep breath in through your nose and out through your mouth. Alright, perfect. There were no adventitious lung sounds heard posteriorly. If you could just turn back towards me. Then I'm going to listen anteriorly, and we're going to follow the same breathing. You can move your breast tissue out of the way from me. This one. And the other one. Okay, if you could lift it up. Alright, perfect. No adventitious lung sounds are auscultated anterior or posteriorly. You have clear lung sounds in all fields. Next, I'm going to assess your cardiovascular system. I'm just going to listen to your heart. I'm going to name 4 locations. When I name them, I'm going to describe where they are, and then I will take a listen. So the first is your aortic. It is in the second intercostal space, the right of the sternal border. Okay. Next is the pulmonic. It is in the second intercostal space, left of the sternal border. Okay. Next is the tricuspid. It is in the fifth intercostal space, left of the sternal border, closest to the sternum. And if you could lift your breast tissue up for me. This last one is the mitral. It is in the fifth intercostal space, left of the sternal border, mid-clavicular line. Okay, perfect. S1 and S2 are noted in all 4 locations. There are no extra heart sounds or murmurs present. Next, I'm just going to check your pulses. If you could put your arms out like this for me. I'll start with your brachial. Okay. 2+ irregular. And radial are 2+ and regular. You come down for posterior tibialis. These are 2+ and regular. There you go. And dorsalis pedis are 2+ and regular. I'm also going to check your capillary flow. Just don't put your shoes back on yet. One more thing. I'm going to check your capillary flow. If you could put your hands out like this. Okay, less than 2 seconds. Okay, less than 2 seconds. Bilateral upper and lower capillary refill is less than 2 seconds. Next, I'm going to move down to your abdomen. If you could just lay flat for me. I'm going to pull this off for your legs. First, I'm just going to take a look and inspect. You have a flat contour of the abdomen, and your umbilicus is midline. I'm just going to take a listen. Are you feeling any pain or tenderness in your abdomen?
Capillary refill is less than 2 seconds of the upper extremity bilaterally, and I'm unable to dock my patient's lower extremity because she has a material. Okay. Next is
Okay. Normal active bowel sounds are auscultated in all 4 quadrants. Next thing I'm going to do is percuss.
I'm going to pull this out and feed it up.
Okay, tympani is noted in all 4 quadrants. Now I'm going to do some superficial and some deep palpation. Any pain or tenderness? Okay, no pain or tenderness noted on superficial palpation. Now I'm going to do some deep palpation. Any pain or tenderness? Okay, no pain or tenderness noted on deep palpation. That is all that we're going to do for your abdomen. I'm going to put this back for you. And you can just sit up. Next, we're gonna move to musculoskeletal and neurological. I'll kind of mix the two together. The first thing I'm gonna get you to do is just stand up. We're gonna do some range of motion activities. So first we will do your spine or your neck. I'm gonna instruct you on something, and then I can show you how to do it. And then there's some that will just be instructions. So if you just do chin to chest, and then look back as far as possible. Then if you would put your ear to your shoulder on your left side, do not move your shoulder up, and on the right side. And then look as far left as possible and as far right as possible. Perfect. Now for arms, we are gonna just, if you could put your hands like this and out, back up again, and back out. Okay, you have full range of motion of bilateral arms. And if you could pull your knee up on either side, and then extend as far as possible out that way, and put it back down. And the other side. Perfect. You have full range of motion of bilateral legs. Now we're going to do your spine. You could bend down and touch your toes for me. Okay, and lean back as far as possible. Okay, the next thing we're going to do is put your hands on your side and push down on either side as far as possible. And the other side. And hands on the hips. And move as far left as possible and as far right as possible. Any pain or tenderness?
No, ma'am.
Okay, you have full range of motion of your neck, your bilateral arms, bilateral legs, and your spine. And there was no pain or tenderness noted on range of motion activities. Next, I'm going to get you to just put your feet shoulder width apart, close your eyes. Okay, perfect. My patient has a negative Romberg test, evident by no swaying. If you could just put your feet together, and then we are going to do some heel to toe walking right there and then back. Okay, perfect. You can turn. Alright, perfect. My patient has a smooth and steady gait while tandem walking. You can go ahead and have a seat. So the first thing I'm going to get you to do is put your hands out. And I'm going to, like this, I'm going to put my hands here. Squeeze as hard as possible. Okay, you have 5 out of 5 grip strength in bilateral hands. If you could put your hands like this, I'm going to push down. Don't let me push down on you. Okay? Now, we're going to do it the other way. I'm going to push up. Don't let me push up. Perfect. Now I'm going to do it for your feet. If you could kind of put your ankles up. I'm going to push down. Don't let me push down. And up. Okay. You have 5 out of 5 strength in bilateral legs. I'm going to get you to do a shoulder shrug as well. Shrug your shoulders up. I'm going to push down. Don't let me push down on you. Perfect. You have 5 out of 5 strength. And your shoulders, cranial nerve 11 is intact. Next, the last couple things I'm going to get you to do. I'm going to put your hands flat like this. Flip them over. And back again as fast as possible. Okay, perfect. Patient performs rapid alternating movements test with no difficulty. And the last couple things I'm going to need you to do is close your eyes for me. I'm going to place 2 familiar objects in your hand. You could just let me know what they are.
Paperclip.
Perfect. What's this?
Corn.
Okay, perfect. Patient accurately identifies familiar objects with eyes closed. And the last thing I'm going to get you to do is I'm going to get you to close your eyes again, and you're going to need to differentiate between dull and sharp touch. This is dull, and this is sharp. You ready?
Okay. Dull. Dull. Sharp. 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 Dull. Sharp. Dull. Dull. Sharp.
Okay.
Sharp. Dull. 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 Dull.
Okay, perfect. My patient accurately identifies between sharp and dull touch.
and then 2 feel the sharp impact. So you can close your eyes and open your mouth. And I'm gonna.
Okay, one more thing I'm gonna do really quickly. So I'm just gonna assess your eyes one more time. Your pupils are back to 4 millimeters. Without light introduced, I'm gonna introduce light again. Okay. They constrict to 2 millimeters when light is introduced. I'm gonna get you to look over my shoulder one more time. And then look, and then focus right here. And follow this to your nose. Okay. Pupils are equal, round, reactive to light and accommodation, and your cranial nerve 3 is intact. This concludes the head to toe.